Now we start scanning pelvis of female. Here we see the urinary bladder, which is almost filled, and it is necessary for pelvic scan of female. Now, if we focus the fluid in the bladder, we see that the fluid is not anaerobic and full of debris. The walls of urinary bladder are also echogenic and appears to be mildly thickened. Now we will also measure the size of wall of urinary bladder. Urinary tract infection is common in female, so we always focus in urinary bladder during the scan. The size of wall of urinary bladder is 5.8 millimeter, which is thickened. The normal size of wall of urinary bladder is up to 5 millimeter. Now we start scanning of uterus. The walls of uterus are normal and isoechic. No mass lesions seen. Now when we focus in the center of uterus, we see an echogenic area in the endometrium. This is transverse view. Here we see an echogenic device in the endometrium. This echogenic material is present in the fundal area as the patient has history of placement of intrauterine device. Here we see the intrauterine device is not at proper place. It is present only in the fundus. It should be visible from fundus to the lower uterine segment or to the cervix. But here the lower uterine segment is empty. It is only visible in the fundal area. Now when we see the fundal part of myometrium, we see that the part of intrauterine device is continuous in the fundal area. The intrauterine device is penetrated in the fundus in the myometrium of uterus. In the fundal area also we see a hypoechoic area and echogenic area, which is other end of intrauterine device, and there is also a fluid collection which is due to muscle injury of the uterus. The patient is feeling pain due to injury of myometrium with the intrauterine device. So the device is placed improper place and injury of muscle layer of fundus and collection of fluid which is blood. Now how we will write report.